Good evening, everyone. My name is Ben, and I'm a health educator here at the Hospital Research Foundation Group Arthritis, and I'd like to welcome everyone to our first webinar of 2025. It's lovely to share this night with you. And our first webinar is called Arthritis with Hands with Chloe Uhrmacher. So I'd like to firstly start with that I acknowledge the traditional custodians of the lands which both I and Chloe are presenting on today. We pay our respects to Aboriginal and Torres Strait Islander elders past and present, and recognise their ongoing connections to the lands, waters, and culture. We honour their histories, traditions, and living cultures, and are committed to working together for a better future. Now, before I start and hand over to Chloe, I would like to say that the question and answer feature is open for the entire night. Even though that we'll get to these at the end of the presentation, what I like to say is if something during the presentation that Chloe brings up, it can be really helpful just to jot that down straight away so we can get to it at the end rather than you just thinking about it for the whole time. Now, we're very lucky to have Chloe on tonight. She's a practicing hand therapist and physiotherapist located in Melbourne at the Melbourne Hand Rehab. Chloe has completed multiple degrees, including a Doctor of Physiotherapy, a Bachelor of Science with majoring in Physiology, and then also a Diploma of Music, which she then extended to complete her Bachelor of Music with a focus in French horn performance. Chloe has a keen interest in combining all of these with her passion in science, the hands, and music to help musicians of all levels return to practice and performing, as music performance can be a lifelong career. So we're very lucky to have Chloe on tonight, and I'll hand over to her.
Thank you so much for that wonderful introduction. My name is Chloe, and as Ben said, I'm a physiotherapist and a hand therapist, and I'm here today to talk to you about arthritis in hands. I thought I'd start by saying what a hand therapist is, because I do get that question a lot. A hand therapist is either an occupational therapist or a physiotherapist that specializes in the upper limb. So we treat wrists, hands, elbows, and shoulders. So let's get started. Today we are going to talk about what arthritis is, what hand therapy can do for arthritis, and how to best manage your hand arthritis. So what is arthritis? Arthritis is a common condition that involves joint pain or joint inflammation. There are different kinds of arthritis, which can include osteoarthritis and rheumatoid arthritis. These two are the most common types, and they're the ones that I'm going to focus on today. But there are other types, such as septic arthritis, which may come from having an infection in a joint, or psoriatic arthritis, which is associated with having psoriasis. Regardless of what kind of arthritis it is, they all feature joint pain, swelling, and changes in your movement. So we'll talk about the differences between rheumatoid arthritis and osteoarthritis. Rheumatoid arthritis is an autoimmune condition which mainly affects the joints that can affect the whole body. Instead of recognizing the linings of our joints, which are called synovial cells, as a normal part of the body, the immune system thinks it's a foreign object and attacks it, just like it would attack a virus or a bacteria when you're sick. As with many autoimmune conditions, this more commonly affects women and often starts between the ages of 65 and 80, but can affect people of any age and gender. It is thought to be caused by a combination of genetics and environmental factors, such as smoking or having a previous infection. And in rheumatoid arthritis, inflammation in the joint leads to thinning of the cartilage, which is the lining of our bones, and bone erosion or loss of bone. So both of these things can lead to joint deformity, or when the joints start changing their angle a bit. In comparison, osteoarthritis is the most common type of degenerative arthritis, and it mainly affects people over the age of 45. It can affect just one joint at a time or several. And it features the thinning of the cushioning between our joints, which is that cartilage, and it has a slower onset. So I love a good diagram. We've got some pictures here to talk about the differences. On the left, we have an unaffected joint, so one without any arthritis. In the middle, we've got osteoarthritis, and on the right, we've got rheumatoid arthritis. And you can see in the rheumatoid arthritis picture that the lining of that joint, that little sac that it sits in, is quite red and swollen and inflamed, as compared to the osteoarthritis joint, which is less red and swollen and inflamed. Rheumatoid arthritis is often symmetrical for both sides of the body. So if you've got it on one hand, you likely have it on the other as well. And it typically starts in the smaller joints, such as the fingers. The swelling that occurs with rheumatoid arthritis can be present, especially in the morning, and lasts for 30 to 60 minutes. Osteoarthritis can affect individual joints. So if you have it on one hand, you may not have it on the other. And it equally affects big joints like the knee and the hip, as well as little joints like the fingers. It does feature stiffness that happens in the mornings, and this typically lasts for up to 30 minutes. So you can see in that middle picture that the ends of the bone are quite close together, and that white lining, which is the cartilage, is quite thin. And then under rheumatoid arthritis, again, you can see that red swollen joint, but you can see those little divots that are happening at the top of that top bone, and that is some of the bone erosion. So why does arthritis cause pain? Joints are very busy places, and there are a lot of nerves that are nearby to those structures. So inflammation in the joints irritates the nerves, which can cause pain. Joints also become stiff with arthritis, and muscles must work harder to produce the same response, which can cause them to tire quickly. So how can hand therapy help to manage arthritis? It's really important to note that no two treatments are the same. Hand therapy is designed specifically for that patient. Therapy can assist with managing hand strength and movement, managing pain and changes in your hand appearance, and achieving your goals, whether that's going to the gym, knitting, cooking, or getting dressed. So one of the most common things that we love to talk about in hand therapy is exercise. We know that regular massage and exercise is important for reducing joint stiffness, keeping your joints and muscles moving, and maintaining your strength. Exercises can include resistance bands, Theraputty, and other tools to help build your strength. And I'll show you some examples of this in the following slides. And we especially love hydrotherapy, which is exercise in water. It's a great way to exercise while reducing the load on your joints, warming up stiff joints if you're in a warm pool, and helping to reduce swelling. So there are specific programs depending on what kind of arthritis we're treating. The SARA program, which stands for Strengthening and Stretching for Rheumatoid Arthritis of the Hand, is a specific set of exercises that have been designed for patients with rheumatoid arthritis. And this features strengthening exercises, movement exercises, and we do have progressions and regressions, which means that if an exercise is a little bit too tough or a little bit too easy, and that may change depending on the day, we can easily move it up or down. We also have the Dynamic Stability Program, which is an exercise program that's been specifically designed for patients with thumb CMCJ osteoarthritis. And your CMCJ is the joint that sits at the bottom of the thumb where it meets the wrist. It's important to note that for all kinds of arthritis, strengthening exercises should be completed when pain levels are low to avoid increasing inflammation. So in this top left corner, we have a person holding the tennis ball, and this is part of our Dynamic Stability Program. So what that person is doing is squeezing the tennis ball with their thumb and their little and ring fingers while making these bunny ears. And what this does is it helps train the thumb to be in a nice, round, open position so that the muscles are able to work their best and there's not too much stress on the joint. So practicing this can help practice gripping in a good position, and being able to lift the fingers demonstrates control. So this is just one of the exercises that we would use. Underneath that, we have Theraputty. Everyone loves this, and we joke that it's physiotherapy Play-Doh. So in this picture, someone is practicing their pinching. We know that if you can keep your index finger and your thumb in a really round position while you're pinching, rather than in this teardrop shape, it puts less stress through the joints. So we usually have patients practice that position, and then when they can do that, we use the TheraPutty to pinch through and strengthen all those muscles up. And we have different levels of TheraPutty. So again, if it needs to be stronger or a little bit less strong, we can adjust that depending on what you need. Now in the lower right, we have a TheraBand, and these are great for doing strengthening exercises as well. In this picture, someone is pulling the band apart to strengthen this part of the forearm. And that can help with things like wrist arthritis. So these muscles, if we build them up, can help do a little bit more of the work and take the load off of the joint. We love TheraBands as well because they're easy to take with you. I have a lot of patients that travel, and I always remind them to put their TheraBand in their suitcase when they're going away. And then in the top right corner, we have one of the hydrotherapy pools. So hydrotherapy is exercise in water. It happens in a specialized pool, which is warmed to 34 degrees Celsius, and it's good for conditioning the whole body, not just the hands. The water provides buoyancy, which reduces load on the joints, and the gentle pressure can help reduce swelling. The warm water can also help with stiffness. Next, I thought we'd look at a little bit of fact versus fiction. So, fiction. Hand exercises will damage my joints and worsen my condition. We know that hand exercises can actually help to improve your hand function, and conditioning for the whole body will also help you to keep fit. There is strong evidence to support aerobic exercise, resistive exercise, which includes weights and bands, and aquatic therapy. Mixed evidence supports yoga, Tai Chi, and dynamic exercise. So it's also fiction that general low-impact physical activities, such as walking, swimming, and resistance exercise, will do more harm than good. We know that low-impact activity is actually really good for you. It is a fact that high-impact exercise, such as running, may be irritating to joints. Low-impact exercise like swimming and walking is generally preferred, but you can make modifications if activities like running are really important to you. We know that, especially in the hips and the knees, this irritation can occur with that high impact, but a good example of making an adjustment would be running on grass or a soft track surface that gives you a little bit of bounce and reduces that impact through those joints. Now, hand therapists love making splints and helping you out with different supports. Evidence has shown us that wearing splints can help reduce pain and enable you to perform tasks that would otherwise be too difficult without that support. They can provide support, warmth, and pain relief for the joints, or allow joints to rest. They can also prevent overloading and further inflammation, especially if you're in a bit of a flare-up. They can also help correct deformities. Different splints can be used depending on what joint is affected, the pain levels, and the activity levels. They can be custom made or prefabricated, and they can be made of lots of different materials such as neoprene, thermoplastic, or leather. And compression gloves get a special note. We love them so much. They can help keep heat in joints and reduce pain, stiffness, and swelling. And over the next couple slides, I have some examples of all of these with pictures, so we can talk about them. Custom splints are often made by a hand therapist and can be made for specific joints. All of these splints are made from thermoplastic, which is a special material that is heated and molded specifically to your hand, wrist, or arm. So we'll start on the left side of the screen with that bright red splint. This is a splint for the wrist and the thumb. And this would be really good for wrist arthritis, thumb arthritis, or someone who might have both. So this is an example of the thermoplastic material, and it can come in a lot of different colors. So you can really, choose something that suits your fashion. In that picture, you can see that the fingers are still nice and free, so you can still complete your daily activities and you can still pinch while getting the support for those joints that you need. Next along is the figure of 8 splint, which is that next red one. And these are really good at making sure that the fingers don't go too far forwards or backwards, depending on which direction that the splint is made in. And it can also be used to correct deformities as well. Underneath that, we have a resting splint, and you can see that this is much bigger than the other splints. These are less functional, but they are really good at allowing joints to fully rest and settle down, especially if they're quite inflamed. So a lot of people, if they have a resting splint, they choose to wear it to bed where they're not going to use their hands a lot and let everything settle down overnight. Next, we can see the silver splint with the pink Velcro that just says wrist. That would be great for wrist arthritis. You can see that the thumb is nice and free, so you can still use that hand quite well. And underneath that, we have another example of a wrist and thumb splint, but in a different material than the red one that you first saw. And then to finish on the right, we have that purple splint that is for the thumb. So that helps to support the joints just through here, while leaving the wrist nice and free to move and the fingers free to move as well. So you can see we can really tailor make these depending on the level of support that you need and the type of material that would be best suited for you. Next, we have prefabricated splints. So these ones are pre-made and they can come in lots of different sizes. So we can still find a really good fit for you. They're made of lots of different materials as well, as you can see. On the left, we have the Comfort Cool. This is made of neoprene and it provides really good support to the thumb. But because it's made entirely of fabric, it is a lot more flexible than the plastic splints that you saw on the previous slide. The Comfort Cool is really good at providing warmth and compression, as well as a bit of structure. Below that, we have the wrist lacer. And this is quite similar to the wrist splint that you saw in the first slide. So it's really good at supporting this wrist joint. We will also use it for things like correcting wrist positioning if you have difficulty keeping your wrist straight up and down. And we can use it for conditions as well, such as carpal tunnel. Above that, we have silver ring splints. These are lovely because they look like jewelry. They're very aesthetically pleasing, and they can be used to support individual finger joints and correct deformities as well. To get silver ring splints, it's best to have a hand therapist measure you in the clinic, so that way we can find the right size for you, and then we can order them in. Next to that, we have the Push CMCJ splint. I like this for patients that are quite active, as it's plastic, so it's very durable, and it's quite low profile, so you can still do a lot of things while wearing this splint. Underneath that, you have an oval 8, which is similar to the figure of 8 that you saw in the previous slide. And again, this is good for making sure the fingers don't go too far forwards or backwards, and can be used to correct deformities. And then on the right, that's an example of our lovely compression gloves. These are the iMac arthritis gloves, but there are other brands out there as well. And these are really good for providing a bit of compression and support and warmth. They have the fingertips free, so you can still scroll on your phone or complete your knitting. And I do have a lot of patients that like wearing these, especially in the winter or overnight. Next, we have neoprene. Neoprene options are very flexible as they are made from fabric and can be used for more gentle support, compression, and warmth. They are often quite soft on the skin, so they can be a nice option for people with more fragile skin if plastic or other options are a bit too hard. The first two you can see are the finger sleeves. So to make these, a hand therapist would take a piece of neoprene, measure it to fit your finger, and then either sew or heat seal that into a tube, so it makes a little sleeve for your finger. These are great if you've just got a few joints that need a bit more support and you don't quite need a full compression glove. The next one you can see is the anti-ulnar drift splint, which is prefabricated. And this is used a lot of times for rheumatoid arthritis, where the fingers may start to drift over towards the little finger side of the hand. As the straps are fastened, they pull the fingers back into alignment, and so they help straighten them out. And then on the right, you can see the wrist and thumb custom neoprene splint. And this would be used similar to the previous wrist and thumb splints that we've seen. But these are just an example of so many ways that we can use neoprene and design different options. It really allows you to be creative as a hand therapist, which is also really fun. And lastly, we have leather options. So as arthritis is a chronic condition, many people can benefit from long-term splinting. Leather is a durable material, and leather splints can last for a long time. They are custom made by a hand therapist. So what we do is we take a mold of your hand and wrist, and we send it to our leather lab, which would manufacture the splint. This ensures that you get a really custom fit. As you can see, just with the other splints that we've seen as well, you can have different support for different joints, whether that's the wrist and thumb, or just the thumb. And they do come in color options as well. So we've got beige and black examples here. We can also customize them as well by adding additional straps or support in specific areas if you're going to be using them for a specific activity. Splints help to protect our joints, but it's also important to know how to protect our joints when they are out of splints. This can help to improve your function and complete your daily activities. It's important to listen to your body and respect your pain levels. Pacing yourself can also help to ensure that your joints don't become overwhelmed and sore. This may mean that you spread tasks out throughout your day or break them down into smaller pieces. Working smarter can include using equipment to make a task easier, changing your hand positioning, or using larger muscles such as your back and shoulders to complete tasks. A good example of this is lifting a heavy bowl. I've got one here. If we hold the bowl from underneath, it's a lot easier to lift, and we can use our big shoulder and back muscles. It's a lot easier than pinching the sides of the bowl and trying to pick it up with our thumbs and our fingers. And avoiding staying in one position for too long can also help to reduce stiffness. Now, I did mention some equipment. We love hand equipment as hand therapists. These can be purchased from stores, online shops, or independent living centers. So I'll have more examples on the next slide, but this example here is a key turn. So rather than trying to do a really little pinch with your finger and your thumb to turn a key in a lock, and maybe having some difficulty with that resistance, key turners allow you to have a bigger grip and use bigger muscles and give you a little bit more force and control to be able to complete that activity. So we've got some great examples here. On the top left, you can see lots of different tools like a comb, a toothbrush, some pliers, and cutlery that have been padded up on the handle with a piece of foam. This is a very easy way to increase the thickness of that handle and make it easier to grip. I really like using foam as well because it's easily removable depending on the type of foam that you use. So you can try out different options and see what would suit you best. Underneath that, we have tap turners. So a lot of patients have difficulty with the taps that make that cross shape. So that requires a lot of twisting, a lot of side-to-side movement from your fingers, and quite a bit of force in your fingertips. Tap turners can slide right over the top of the tap and create a bigger lever. So again, you can use your bigger muscles and have a better grip to be able to turn the tap. In the middle is one of our favorites. It's a kettle tipper. So with this, your kettle lives inside the kettle tipper. You can boil it as normal, and then when you're ready to make your cup of tea or coffee, you just need to push the kettle over for the water to come out. You don't have to lift it, and you don't have to put strain through your wrist to do so. And then on the right, we have just a plain old food processor, nothing fancy. You can get these at a lot of kitchen stores, and they are great for being able to chop your food finely or shred vegetables, for example. So this is an example of working smarter, not harder. Rather than sitting there and cutting those vegetables by hand, you can just throw them in the food processor, and it takes just a few moments. And then last but not least, we have a pencil grip. Again, just like the foam that we saw on the utensils in the top left, this can thicken the pencil, and so it's easier to grip, and the texture of the pencil grip, if it's a bit rubbery, can also make it easier to hold on to. And these don't have to be anything fancy, they can just be the normal ones from Officeworks, although we do have some in the clinic that we love a lot. So you can see equipment can be provided from independent living centers if you're looking for something more specific, or it can just be from general shops or online. So something else that can really help with managing symptoms is warmth. We know that heat can loosen tight muscles and stiff joints, soothe aches, and improve circulation. It's ideal when preparing to complete activities around the house or completing your exercise program. I also have some patients that after they complete an activity and they might be a bit sore, they use heat to relieve their symptoms. Examples can include a heat pack or a paraffin wax bath. Now, not a lot of people know what paraffin wax baths are. We've got a picture in that corner there. So it's a container of warm wax that's heated to a body safe temperature, and you dip your hand in like the person in the photo is doing. The wax coats your hands, and so it really traps in that warmth. And we often have patients do their movements or their exercises with the wax on to get the best out of that heat. It's really important to note that for patients with rheumatoid arthritis, it's not recommended to put heat on your joints during acute flare-ups because the joint is already hot and inflamed. It's always good to talk to a hand therapist or another medical professional about what to do during your flare-ups overall to help settle down your symptoms faster. A lot of people use arthritis creams and find benefit from them. There is moderate to limited evidence, and we also know that massage can provide short-term relief, but it doesn't actually change the condition of the joint. So it's important to use this alongside things like splinting or exercise to actually change your function day to day. And then you can use things like arthritis creams to help soothe aches and pains. It's also really important to look at the ingredients. So some contain ingredients such as capsaicin or arnica, which can give you that really warm feeling. And then there are other ingredients such as menthol, which may give you that really cold feeling. And then some creams contain salicylates, which that's a component of aspirin. So anytime that you're wanting to try something new, you should always ask your GP or your pharmacist if there's any risk of interactions with any other medications you might be taking or any other health concerns that you might have. It's also really important to watch out for changes in your hands and your wrists. So you should always look for sudden changes, and this can include things like nerve symptoms, which might be tingling, numbness, or pins and needles. Notable muscle weakness, especially if it's quite quick to come on and you haven't had anything like this before. Or if you have new pain, especially if it's in a different area than you usually have pain. If any of these occur, it's important to be reviewed by your GP, your hand therapist, or another member of your health team. Sometimes it can be changes in your arthritis, but I've also seen it where a patient with arthritis comes in and the pain's actually not related to their arthritis at all. It might be from something like carpal tunnel, which is a nerve condition, or it might be an overuse injury that's making a tendon sore. But because they've had hand or wrist arthritis before, they're not quite sure what the pain's actually coming from. So it's always best to check in with one of your health professionals. So in summary, so much can be done for arthritis. Empowerment really is key, and hand therapy can be integral to hand health with arthritis. No two treatment plans are the same. We can see that we've talked about lots of different management strategies today, and your hand therapist and healthcare team will create an individual plan that is best suited to you and your goals. I just wanted to say thank you so much for watching today. Again, my name's Chloe, and I've got the contact email there. I think we've got time for some questions now, and Ben is going to chair that. So looking forward to chatting to you all in a few minutes.
Absolutely. Thank you so much for that, Chloe. That was a fantastic overview about hands and arthritis and what can be done. The first one that I'll raise is in terms of actually seeing a hand therapist, especially because we're a South Australian organisation, is there a website or is there a way that people can kind of find a hand therapist?
Absolutely. So the AHTA, which is the National Body of Hand Therapists, has a website that has a search function. So you can pop your postcode into the function on that website, and you can see all of the accredited hand therapists that are in your area. So I've done that before when patients might come to see me for a few appointments, but they live regionally and they want to know who's the next closest person that they can come see. So it's a really good function on that website. And I also like to note that you don't need a referral to come see a hand therapist. It is always good to check in with your GP and discuss things if needed. But as physiotherapists and occupational therapists, you can just book in without a referral, and we can also see you that way.
Wonderful. So what was that website again?
So it's the website for the AHTA. And if you just type in ahta.com.au, that brings you to the Australian Hand Therapy Association. And they've got that search function.
Perfect. I mean, following on from that, and you said with people coming in privately, someone's asking if hand therapists are covered by their EPC Medicare plan.
They actually are. So oftentimes your GP will specify whether it's a physiotherapist or an occupational therapist. But for example, my clinic has both. So you would be able to see any of us with your EPC.
Wonderful. And then with that as well, I'll kind of raise it being the start of the year, the refreshed. So it's one thing that I always kind of say is it's a good time to talk to your doctor. And if you're interested in seeing, a hand therapist, physiotherapist, it's one of those times to have that conversation and fill that out. Someone's asking about recommending strengthening exercises when patients or people living with arthritis are in for a painful state, or is it best to wait until that pain's under control?
So it is really important to do exercises with arthritis because building up those muscles can help support the joint. But sometimes if you're having a flare-up period, for some people that might be a few days, for some people a bit longer, we typically go gentler on the exercises because we want everything to settle down, and it's really not worth the pain to push through and do your exercises while you're really, really sore. A lot of people believe in no pain, no gain, and we don't believe in that because we want to make sure you're nice and comfortable and you can do your exercises effectively and with really good form. And I find that if you're in pain, you're not going to be at your best for your exercises.
I'll do a follow-on from that as well. I think, can you comment on how important it is if exercises that you as the health professional have diagnosed someone or given someone to do and they're finding that they're painful, do you find it really important for them to have a conversation at their next appointment?
Oh, absolutely. And I'll often tell patients, if your next appointment is in 2 weeks and you're in pain and things aren't working well, call us and move it earlier so we can talk about it. There's always adjustments that we can make. It might be a change in positioning of your hands. It might be a change in the equipment that you're using, but we always want to know about it so that we can fix it.
Wonderful. Really, really well answered. Someone's asking about the splints that you messaged. and they're asking about the costs around that. Are there different costs around the different splints and things?
There are, and this really depends on the clinic that you go see. I know that if you have a specific splint in mind, you can ask about the cost beforehand, specifically with those prefabricated ones. But I always tell my patients in the consult what the price is before they commit to one. So if they're choosing between, 2 or 3 different thumb splints that we think are suitable, we'll talk about the costs of each one. But I don't have a specific cost because that really depends on the company that you see, the clinic that you see, because we all use slightly different materials.
Wonderful. I guess, can you comment as well, as I'm sure everyone knows if they've been to a pharmacy, there's usually a range of off-the-shelf splints and things like that. Can you comment if they're appropriate for people, or is it best to see a professional to make sure it's going to be the right thing for you?
Some of them I don't mind, but a lot of the times they do half the job. I've seen patients come in with a splint that's supposed to support their wrist and their thumb, but it really only supports the thumb and not the wrist. So it may not be doing the whole job for you, or it may not be targeting the specific area that you're wanting. So I do have patients that bring their splints in from the pharmacy, or they might say, can you help me look at a pharmacy splint or one that you've got? We can really help you make that decision once we know where the problem areas are and really how you need support.
Wonderful. Really, really well answered, Chloe. Someone's asking, you talked about the Sarah protocol previously. Yes. Can you give some examples of exercises involved in that?
So there are quite a few of them. I'll just run through a few of them. It really does encompass everything in the upper limb. So one example is wrist circles, which is a really easy way to keep your wrists moving. One example we have for the shoulder is being able to reach behind and touch your head. For some people, this is really, really easy, but for some people with rheumatoid arthritis, where it affects the shoulder, this can become really, really difficult. So trying to keep that range of motion is super important. We also have finger walking, which you typically do on a table, but I'll pretend. And that means individually moving your fingers out and then back the other way. And I always tailor these to the patient. So I have had patients come in before that are in the really early stages of rheumatoid arthritis, and some of the exercises are way too easy for them. So I might add extra challenges that are slightly beyond the Sarah program if I think they're appropriate. So it's in giving these examples, they may not be the best option for you specifically, but those are some of the exercises that we would use in the program.
I think that's a great point, is that all of the exercises and why, fantastic professionals like you exist is they're going to make it a personal program. And it's rather than just finding exercises online and things like that, they can really target which joints are affected and what you kind of want to do with your life and how that's going to help long term, which is amazing thing.
I was going to say, for example, I had a patient today that really wants to get back into golf. And so we were working on specific exercises for working on her golf grip and being able to grip a golf club, which is really different from exercises for someone that wants to get back into knitting. That's really fine motor and it's really different.
Wonderful. Someone's asking about diagnosis for different types of arthritis and if hand therapists can do that, or is it best to see, your GP, rheumatologist, and those kind of health professionals?
I do think that a GP is a good first point of call. As a physiotherapist, I can send for something like an X-ray to look at osteoarthritis. But for rheumatoid arthritis, you do need to have usually a blood test to look at different factors that are affecting the whole body. And oftentimes people will come see us either before or after they see a rheumatologist, but it's usually in the process. So they may have been referred to the rheumatologist, they're not quite there yet, so they come to see us, or they see us after the rheumatologist. But for rheumatoid arthritis specifically, it is good to have a blood test and have kind of that really medical side of things as well as the physiotherapy side of things going on.
Wonderful. Someone's asking that you mentioned in terms of hydrotherapy and things like that.
Yep.
Do you think that swimming would be helpful for thumb arthritis?
So you may not think so, but with swimming, if you are training your back and your shoulder muscles that get a really good workout as you're swimming, they're going to become a lot stronger, and your strength for activities can come from there. So when I was talking about lifting up my bowl here, if my back and my shoulders are really strong from swimming, that's a lot easier. If they're not as strong and I don't feel comfortable holding it like this, I may default to this position, which puts a lot more pressure through my thumb and my fingers. And for example, at one of our clinics, we run a hydrotherapy class where patients can attend and get specific upper limb exercises in the pool. So general swimming is great. And then you can also have specific hydrotherapy that's usually run by physiotherapists that can target different areas.
Wonderful. And I'll say, if anyone's from South Australia, the Hospital Research Foundation Group Arthritis, we do run hydrotherapy classes. So we have some in Welland and in Mile End as well. If anyone's interested in that, it's best to contact us. So our information line, the 1-800-011-041. If you're in South Australia, is a fantastic port of call if you're interested in talking to someone about that. Someone's asking in terms of rheumatoid arthritis specifically, and then that idea of how does rheumatoid arthritis affect the fingers and the wrists over time? Is it a case-by-case thing, or is it is there a general pattern?
It is case by case. I have some people that come to see me when they're in their 30s with rheumatoid arthritis, and I have some people that are newly diagnosed when they're in their 60s. So it is very individual, and different people progress through rheumatoid arthritis at different speeds. Probably the biggest thing that we see as it continues to progress is the deformities that a lot of people end up with in their hands. So for example, the fingers might start to move in that direction and might have more of a flexed or bent position, and the wrist might start to move over as well. I have a lot of patients that like to wear splints overnight, especially in the early stages, because it helps maintain that position, and you're not doing a lot with your hands while you're sleeping, so you might as well be keeping them in a good spot. I use the analogy of wearing a retainer to keep your teeth from moving around after you have braces. So keeping a splint on overnight, if you have rheumatoid arthritis and you're starting to notice those changes, can help adjust and keep them from progressing further.
Wonderful. And I really like that analogy. It's a fantastic one. Someone's asking if carpal tunnel syndrome is connected with rheumatoid arthritis at all. Is there any link between those two?
So carpal tunnel can happen because as the wrist changes position over time, it can put pressure on the nerve that runs through the middle of the wrist, which is the median nerve that's responsible for your carpal tunnel syndrome. So we usually see that as the wrist positioning starts to change. I haven't seen it very commonly, but I would also think that if you've got a lot of inflammation in the wrist, that extra inflammation might put some pressure on the nerve as well. But I most commonly see it where you're actually getting a position change in the wrist.
Someone's asking if you can put a number on this. This might be a very difficult question. In terms of hand therapy, how many sessions would you generally see people for in relation to osteoarthritis?
It depends on the person. I know that the SARA program, which is the rheumatoid arthritis one, is designed to be taught in 6 sessions. And they start off at weekly and then space out to every 6 weeks as we go. And that osteoarthritis can often follow that pattern where the first 2 or 3 sessions might be weekly as we learn more about what your hands need and how they react to different exercises and different methods of managing arthritis. And then as things settle down and we learn more about your hands specifically, we can space things out. I also really love patients to become more independent. I always joke that hand therapy is a really bad business model because we want to, have people manage their own conditions. But eventually we want people to be independent, have their exercise program, know what to do if they have a flare-up, know when they're ready to progress. And sometimes I only see people a few times a year when they feel like they need a bit of a tune-up or a bit of a chat about something, or they might just need new exercise equipment and want to make sure that they're ready for that.
Wonderful. So someone's jumping on the back of that question as well and asking, and this might be a case-by-case basis again, how often do you need to do the exercises to get the best out of your hand therapy appointments?
So that can kind of depend on if you're having a flare-up or not. If things are flared and you're having pain, we know that pausing those exercises just to let things settle down, or maybe only focusing on your gentle movement exercises would be beneficial. But ideally, I like patients to be able to do their exercises every single day. And then when you get to the point where things are really strong and stable, it's okay to do them every other day because you've built that strength and then you're more in a maintenance mode rather than a rehab mode. So initially, we're aiming for every day. And then once things are nice and stable and you're nice and strong, then we can move to every other day.
Wonderful. So it's a bit the same as we were talking about before. It's always about that communication. If you're struggling to do them as prescribed by your hand therapist or your physiotherapist, having that discussion with them and making sure it's working for you.
Exactly.
All right. Well, that's all the questions we've got, Chloe, and wraps up pretty much getting close to the end of time. Greatly appreciate your time tonight. It's been absolutely fantastic and it's been lovely having you on. And it's been a fantastic way to start the year of webinars. We've got lots of exciting ones coming up. So thank you for everyone for coming along tonight. And I hope you enjoy the rest of your night.
Thank you, everyone. It was lovely to present to you all. It's really fun.